Greetings. My name is Father Norm Ermis. We're here at St. Peter's Parish in Boerne, and today we have a great opportunity to interview Dr. Mark Ogden. Dr. Mark is a parishioner here at St. Peter's Parish, and he's also an emergency physician in San Antonio. He and his wife Amy and their children are members of our parish. They have been since 2006 when they moved to Boerne, and we're very happy to have him here today. Dr. Mark graduated from Midwestern University, the Chicago College of Osteopathic Medicine, and his residency was in emergency medicine at Midwestern. And Dr. Ogden has worked in San Antonio as an emergency physician all these years since moving here. He is also the EMS director for multiple agencies within Bexar County and Wilson County here in Texas. And he is a member on the Emergency Medical Task Force and is currently involved with COVID-19 screening and notification for the San Antonio Metropolitan Health District. A couple of weeks ago, as you may remember, we had an interview with Dr. John Burnside, a child psychiatrist, and we focused on how families and especially children are adapting to the coronavirus pandemic with all the restrictions, staying at home and social distancing and all of that and the implications of it. And today we have this opportunity to talk with Dr. Mark about medical aspects of this, as well as human interest dimensions of being a doctor and in the healthcare field, and also looking at how we restart a parish as we come out of the restrictions that we're living in. So I want to welcome you today, Dr. Mark. It's great to be able to have this opportunity to talk with you from all your experience and your knowledge of our parish. First I want to focus on medical related questions, and I have a few that are what I call contextual questions. And so the first one is just, if somebody has symptoms that are consistent with COVID-19, is the first thing to do just to call your family physician and try to go through this at home? And is it appropriate in all instances with those symptoms to be tested for COVID-19?
Sure, and that's a great and I think a very common question right now.
Okay.
There's a lot of discussion in the media around testing and who should be tested. And so the short answer to that is, if you are a healthy person and you don't have risk factors like immunocompromise, heart disease, renal failure, and you don't have serious signs and symptoms, those could include persistent pain in your chest, shortness of breath, dizziness, pale color, blue lips. These are things on the CDC website that indicate serious illness. If you're not in those high-risk groups, calling your doctor first is certainly the best choice.
Okay.
The advice you may receive is to actually stay home and self-quarantine yourself.
Okay.
Not everybody at this point requires testing.
Okay. And so what is kind of the tipping point, if you will, when somebody is ill and at home that maybe they need to get to an emergency room?
Sure.
What would that be?
And that's really important to know. So any of those symptoms, persistent pain in the chest, worsening shortness of breath, feeling lightheaded, looking pale, change in the skin color, any of those things should warrant either a call to 911 or having a family member take you to the hospital. I think it's important, though, to also mention at this point, since I'm in the emergency room, it is very helpful to the care team to call ahead if you're going to come by private vehicle, so that we can prepare and you don't spend any time in the waiting area potentially infecting other people.
Okay, good, good. And then just from a medical perspective, what would you say is the closest or most parallel experience to the COVID-19 that you've had in your career yet? And how does it compare? How is it the same and how is it different? And what are the lessons that we can take from it?
Sure. Well, that's a tough one, because really we've not, at least in my career, we've not dealt with anything on this scale.
Okay.
The only similar experience that I have to draw on, and it really pales in comparison, is when I was training in Chicago, and there we had environmental conditions that sometimes confine patients to their homes.
Okay.
Extremes of heat,
Right.
cold, snowstorms. During those times, we also found patients who were suffering ill effects of just being homebound. So not necessarily a pandemic,
Right.
but their chronic medical conditions were being made worse because they could not get to the doctor, they could not pick up their medications. Some succumbed to the elements themselves, and so that was a subcategory. But there is a parallel there with being confined to home and
Right.
having the conditions that you already were living with be made a little bit worse.
Okay.
As far as comparing to anything like this, I just frankly don't think there has been anything
Okay.
yet. So that's a tough
So
one.
it's true that we're in a history-making event right now, and we're all managing our way through it.
Absolutely.
Okay, great,
Absolutely.
great. Okay, how are allergies and influenza different than COVID-19? What are some of the symptoms and other things that go with it?
Well, most of the patients, according to the recent data from San Antonio's health department, seems to indicate that the majority of patients that are COVID positive do have fever.
Uh-huh.
Not all, but a vast majority. So that would differ from, let's say, the oak pollen that we're all dealing with right now. Generally speaking, allergies will not produce fever, certainly not high fevers.
Okay.
And so that is an important distinction. It is worth mentioning, though, that this virus is very difficult to diagnose just clinically looking at a
Okay.
patient. We've gotten pretty good at looking at a patient in the emergency room who has the flu, and they sort of look sick, and during flu season, we sort of think, oh, that person could have flu. But right now, COVID symptoms are very wide-ranging, from asymptomatic to the very, very seriously ill, that there is overlap. So there is some overlap with what we think could just be allergies.
Okay.
For that reason, we have a little bit more likelihood to test patients this year for COVID versus just chalking it up to the seasonal oak pollen.
Okay. And how important is it to remain as healthy as you can in general, like getting vaccinations for things like influenza each year that changes, and maybe if you have allergies to treat them so you don't get upper respiratory and complicate other, how important is that?
I think the vaccine question is probably the most relevant right now, and I think it's a lesson that we can all take from this terrible thing that's happening to us.
Yeah.
Many of us have heard in the news that we're hoping there's an antibody test coming out soon. And so why are we so excited about an antibody test? Well, if somebody's been exposed to COVID-19, they will develop antibodies. That protects what we call the herd,
Right.
and it can help reduce the spread of this horrible disease across the community.
Okay.
Well, the vaccines are also doing that for these other illnesses, pneumococcal illness, influenza, both very dangerous in their own right and kill and make many patients ill every year. And so the vaccine is an important way to increase herd immunity across those diseases, just like we're trying to measure now for COVID. And so very, very important. As far as keeping yourself healthy, a healthy immune system is a good defense right now. It's the only one we have. There's currently no vaccine and no medication for COVID that we know works.
And the hope is that a vaccine will be developed, as say we have for influenza. But there are many people who are suspicious of vaccines, and some who just will not even take them themselves or for their children. Are there any insights or pieces of advice for people like that who don't believe in vaccines?
Sure. So for me, as a physician and having a science-based background, that is a challenge for me, and I want to respect the individual patient's beliefs, especially if they're religious beliefs and religious reasons for why they're skeptical or not wanting to have vaccinations. But if it's just an educational issue, then I want to really encourage patients who have doubts or concerns to consult the physician that they feel comfortable with and whom they trust, and get accurate information about vaccines, learn about how they can protect your family, but even more importantly, how they can protect your community. And then use that information and make the best decision you can.
Okay, great, thanks. Now, how about this, people want to get back to what we call normal. They want to go back to work, have kids back in school, all those things in life. And there's a question, are we really going to go back to the old normal, or is there going to be a new normal in our communities? What is your sense of that right now? And if it is going to be a new normal medically, how do you envision what that's going to look like for the near term?
Right. So normal is sort of an interesting term. I guess it just depends on your frame of reference. And after this, I think our normal will necessarily change. And that's normal human behavior, is to adapt to this. And there will probably be some good come of that. Let's remember that influenza A and B in this country is responsible for 25 to 60,000 fatalities a year. And so practicing a little social distancing during flu season next year and using good hand hygiene and not
Right.
touching our faces and thinking about vaccination could actually be a behavior modification that pays us some dividends down the road for these illnesses in the future. Practically speaking, we may see less handshaking. Maybe we'll see less close contact in the community, and we'll all learn to adapt to that and hopefully not lose the community that we've built and that personal touch.
Okay. And what changes do you think will come about in medical practices going forward from this historical event? Like, do you see changes in how you practice medicine and even the patient-doctor relationship? And how do you see those changes happening?
Well, one of the biggest changes in the emergency room is I have to introduce myself and tell patients the next time you come in, you'll get to see what I look like. Because I'm wearing a mask and
Right.
goggles and a gown. And it must really be traumatic. I try to put myself in their place and think, you know, especially my pediatric patients, how must they feel to see this person come in and all they can see is my eyes.
Yeah.
And so we've had to really make sure that we're addressing the human element more so than ever.
Sure.
Because now the facial and sort of the body language communication has been altered so dramatically. So we need to focus on making sure the patients are comfortable with us. And we're looking at technology, telemedicine, distance evaluations, telephone, all these different ways of reaching out to patients, home testing if that's available. So I think all of those things are important and will become part of practice going forward.
And are there any other trends that you see taking place because of this? Maybe like telemedicine or anything of that nature?
That has really exploded, and CMS, Medicare and Medicaid, and many insurers have sort of stepped up and just given blanket approval for that sort of thing right now. As physicians, we're all tasked with making sure we use that responsibly.
Right.
And so that has been a new challenge.
Sure.
We need to remember that the physical exam is still necessary in some cases, and so some telemedicine or distance evaluations will likely result in still having to come to the hospital, but it could be a first step for getting direction on where you need to go next.
Right. Okay. Thanks. Now, for people who may have anxiety disorders or panic attacks or things of that nature, maybe depression, I'm sure that this must be exacerbating some of those symptoms. So are you seeing any of that in emergency room care or in general?
Quite a bit. I would say almost every shift in the emergency room, I am treating a patient whose primary need is actually an anxiety-related need. And we may be doing some testing in cases to help alleviate that for them. And it's completely understandable. There's some baseline anxiety. Now I'm cooped up in the house and I can't get out and I watch news all day long about the pandemic. And some of the information I'm getting is good and some of it is not. And so we are seeing quite a bit of that. We're treating it mostly with education and counseling and not so much with medication. That does take more time than we're used to in the emergency department. But it's an important part of what we're doing now.
Okay, what are some practical things that we can do on our own to reduce stress and anxiety and depression on our own, just without medical intervention?
Sure. I think one of the first things that is important is not to overindulge at this time. And there has been some abuse of substances in the home during this time. So first of all, don't turn to those things. And then good diet, keeping yourself healthy, trying to keep a normal habit. Get up in the morning, get dressed, take a shower, do your normal things. If you're not going to the office, do some work from home at a normal time. Start your day at 7 or 8 a.m. Try to keep a normal schedule because we will go back to work soon, and everybody will need to adapt to that. When you can, get outside, enjoy the beautiful weather like today. Just keep your distance from each other, as the mayor has told us, those important guidelines, and get exercise when you can.
Okay, great. And how about for teenagers? Is it okay for them to socialize with maybe one or two of their friends by, say, going to their house or visiting with their families, things like that? Or what's your advice on that?
At least for now, and recommendations will change as this pandemic evolves and hopefully devolves and levels off and tapers down here in a little bit. But I'll use an example. Just on my way over here to meet with you today, I went by the river over here, and I saw a lot of people gathering, and I did see a group of 4 similar aged young people near the water.
Right.
And it occurred to me that, okay, some people may initially react and want to be angry with them or say, well, why are they doing that? Well, they may all be family members. I don't know that. And if they've been in quarantine and isolated together for all these weeks and they're together at the river today, that's okay. But if you are teenagers coming from different homes and you want to get together, this is not the week to do that. Okay, so we should still be keeping our spacing, wearing a mask for sure if you're going to be within 6 feet of those. But I would recommend not doing that to any great extent right now, because we're still trying to get that curve to come down.
So about how much longer do you anticipate we should do that?
We're looking at those phased sort of opening strategies that we've seen on television, and I think for now the best advice will be watching, because this is changing daily, watching for the green light from our local health department and the mayor and when that's okay.
Okay. And here are a few questions regarding San Antonio and the Bern area specifically. When do you think that in this general area of Texas we're going to peak? That peak thing they keep talking about, that's kind of a sign that we're over the curve, so to speak.
Well, and if we're lucky, we will get a simple peak. It seems like the pattern that we are anticipating is a little bit more of a plateau followed by a decline. And currently this week, there's a little stuttering indication on the data out of the health department that there's been some decline and then a little bit of a tick back up. And so we're watching the trend line. We could be there now. We just need a few more days to verify that.
Okay. And is San Antonio and the Bernie area and its hospitals, are they equipped well enough for still people coming into hospitals and that, or where are we in that?
Capacity in our hospitals in San Antonio right now is very good overall.
Okay.
And I do see daily reports from the consortium of hospitals in the city. Ventilated patient numbers have been declining a little bit for the last few days. And capacity seems fine. It doesn't look like we're at a crisis mode at all right now. That could change if we get into a worse situation, but for now things look like they're going very well. Okay,
good. And do you think that San Antonio and Bernie, the hospitals and healthcare facilities, do they have enough of the tests for COVID, the kits, or not?
I think first you have to ask what are enough tests? What number is that? And I have patients ask me all the time, should I get a test? Can I get a test to go back to work? And I like to remind people, if you get a test today and you're negative, that's great. This is not an antibody test. Your test may become positive tomorrow or the next day. So how many times do we want you to do this? So that is the difficulty with knowing how many tests we need. If we're testing people who are symptomatic and need to be tested so that we can trace contacts and do these things that we've been doing nationally, we have what appears to be adequate testing in the community at this time.
Okay. And of the basic safety practices that we should have, like social distancing, wearing masks, hand washing, and that, are there any additional things we can be doing to stay safe and to stay healthy as we enter into this peak or plateau area?
I think just do the best we can to fight off the indifference or the fatigue that is coming from this. These things work. Hand hygiene, not touching your face, wearing a mask within 6 feet of others, even a cloth mask for the general public. We're trying to save the surgical and the N95s for the healthcare workers. We all miss our elders and our grandmas and grandpas and our moms and dads, but probably now is still a little bit too early to have folks over for dinner and think that it's okay. Let's not get complacent now. We're not quite there. We've put in a lot of hard work. We just need to push this over the tipping point here in the weeks to come.
Okay. And most of the restaurants that are serving food yet are all takeout. And I was at a restaurant recently to pick up food, and nobody behind the counter was wearing masks, preparing the food. And I was wondering, is that safe? So I guess my basic question is it generally safe to eat takeout food from restaurants in Bernie and San Antonio right now? What's your opinion on that?
Thankfully, yes. I'm taking advantage of that quite often at our house. And yes, the food is safe. If you're going to be within 6 feet of those workers to pick up your food, then they should be wearing masks. Definitely. But I don't have any concerns. I haven't seen any data that eating food that has been prepared and that you've picked up is a way to catch COVID-19.
Okay, great. Now a few human interest questions. First of all, from your personal experience and from what you hear expressed by other doctors and nurse practitioners and that, what are your main concerns as professionals about dealing with patients with COVID-19?
Well, I would say one of the biggest concerns we have is when they start to feel ill at home, that they may sometimes, and this is understandable, we all have responsibilities, we have financial responsibilities and personal responsibilities, and we're getting to a point where this whole isolation and social distancing thing is starting to fatigue some folks. And we're very concerned that patients who may feel a little bit ill or have a fever or a little upset stomach perhaps will keep that inside and just go to work and say, it's time for me to go back to work.
Right.
And that could be a very bad thing for us if we're trying to really wipe this out. So it's just right now the fear is fatigue and that I think understandable desire to want to get back to our lives.
Right.
Yep.
Okay. And as a medical doctor in the middle of this pandemic, how does that impact your family and family life? And what concerns do you have about going from work back to home?
All right, so my biggest concern is that I'm exposed to patients who are COVID positive virtually every day. So if that makes anybody at home feel better, so far I've been okay, and this is what I do for a living. And it's through wearing the proper gear, washing, not touching the face, and those sorts of things. But now that our kids are home from school, and that's completely reasonable and the right thing to do, my 3 kids are at home on the computer doing their homework and their classes. I've got one who's home from college doing his stuff, and my wife is home, and we've got 3 dogs who, who knows if they can carry this or not. That's up for debate. So my big thing is, and I think like most doctors and nurses, all we want to do is be part of the solution. Our worst nightmare is to bring something home.
Sure.
So for me, I'm getting to exercise one of my favorite hobbies, which is camping. Unfortunately, I'm camping in my yard in a motorhome, and that's my way of distancing and trying to keep this out of my house.
So you literally live separate from the family?
I've got a camper next to the house.
Wow.
So that's what I'm doing, and not everybody's doing that. That might be a little overkill, but for me, that's what we're doing, and we're getting together with some distance on the patio in the evenings.
Wow, that's incredible. Are there any other big changes that you've done to protect your family like that? I mean, that's huge.
Well, it's just all the little things, laundry and making sure that we keep things separate, and we're just doing everything we can to not bring it into the house. Yeah.
Good. And what beside that, what other tolls does it take on your family life as a doctor?
I think my family, at least, probably is more worried about this than I am, just because I'm immersed in it.
Right.
And so it has created anxiety, and I think that's common for all healthcare providers. I think their families are quite anxious that their loved one is working in this environment every day.
Right. Okay.
Yeah.
And how do doctors and other medical professionals help each other? What's the dialogue and interaction that goes on, if any? I guess I experience a lot of doctors as what I'd call stoic. So I don't know if you're as stoic with each other or if you really do reach out and have that human dimension. What do you see happening, and how do you find the support you need?
Well, at least for my colleagues, we tend to sort of talk about the science and talk about the numbers and those sorts of things, and what we're doing with our families. And we try not to really focus on the risk, I suppose, because we know this is sort of why we got into this. This is our job. So we support each other, but at least the circle of docs and nurses that I associate with, they are sort of stoic and sort of keep things to themselves. So every once in a while, a little comment, hey, how you doing? How's your family doing? That's about enough.
Okay, great. And just in terms of your Catholic faith, how much does that play a role in your personal life as a physician and how you practice medicine? And how has it maybe been affected or impacted or a part of your treating patients during the pandemic?
I think the biggest thing for me is when it comes to fear of catching coronavirus, fear of being infected. I'm taking steps to do my part to prevent becoming infected or spreading it to my family. But when I see a patient or walk into a room, at least for me, I feel like God is with me and protecting me, if that's how it should be. and I get quite a bit of strength and peace from that, and then it allows me to just do what I need to do, and I'm not so focused on what could happen.
That's great.
Right?
Okay.
Yeah.
And if you were invited to give a motivational talk now to other doctors and medical professionals, what do you think would be your advice and focus in a talk like that, taking everything you've learned in your whole career, but especially now during the pandemic?
So for the 2 people that would show up for that one, let's see. What would be my advice for the pandemic? Boy, be prepared. That's one thing that I think we've all learned the hard way with this as medical professionals.
Yeah.
These things can and probably will happen again, and it did catch us a little bit off guard.
Okay.
So we need to be prepared.
Okay, good. And now just a few questions related to parish life itself. Once the restrictions are reduced, because I sense it's going to be a phasing out of the restrictions, not just a carte blanche end to them. And so as we phase out and finally get to the end of the restrictions and can return more to normal, what advice can you give to us in the parish in terms of creating a kind of plan for restarting the parish? What do you think the focus of that should be?
This will be a real challenge. First and foremost, we need to protect those that are vulnerable.
Right.
And so that is going to require their participation. They are going to need to be active in that.
Right.
So getting the information out to our parishioners who are at higher risk, letting them know who they are,
Right.
so that they can be active in protecting themselves. And then providing, I think, the environment to allow them to make that happen. So
Right.
we may need to reduce the number that we can admit to the church and gradually phase in larger numbers,
Right.
so that we can keep proper spacing. Perhaps even considering having special services for folks who maybe are at higher risk, where we can have a very, very small attendance with large spacing. And all of these things, I think, and I'm happy to work with you on this.
Sure.
it'll be as the recommendations come out from Health
Okay.
Department, and you'll see some of those things for sure. That will be part of reopening, but we'll work on those.
Okay,
Yeah,
good.
yeah.
And in terms of, the parish has been trying to figure out how to make its way through this pandemic and what kind of ministries we need to do. And so we've focused on what a lot of our parishioners are concerned about as doctors and other people in the professional healthcare fields. And so we've done things where we've included prayer for them in some of our other services and during masses and things. But just in addition to that and prayer for you individually, what could we be doing as a parish to support people in the medical fields?
Prayers are number one, and I do thank everybody for praying for us. Additionally, there was a time where we were asking for help with supplies and things. That has come around and improved to where that is not so much of a need. Really, at this point, it's just following the guidelines and helping us with this struggle.
Okay.
Yep.
And again, without breaching confidentiality, is there one case or situation during the pandemic that just really captured your imagination that you might be able to share with us?
I think it was the first patient that I saw that tested positive, and how that changed the whole feel in the environment in our emergency department, how it became real. So it actually wasn't so much about the individual case or how sick they were or what their CT scan showed. It was just what it did. It was a turning point for our team, and how that changed the way we functioned and how it just became real for us.
Okay, very good.
Yeah.
A little bit like when I heard the first case with the worker at St. Luke's Parish in San Antonio that died from COVID-19. It was like, that was when I finally made the decision, okay, my staff's been advising you, make a statement to the parish. I guess this is the tipping point. So it's sort of like the reality sinks in.
Right.
Is there any final piece of advice or insight that you'd like to share with us that can be helpful to parishioners?
I think the only thing I would say is keep up the good work, keep doing what we're doing, monitor yourself for symptoms. If you're in a high-risk group or you have those serious signs and symptoms, pressure in the chest, high fever, shortness of breath, then make sure you seek medical attention. And when in doubt, 911 is there to help you.
Great. Okay, thanks.
All right.
Well, I really appreciate this opportunity to talk with you and
Thank
to
you
give
for the
your advice
invitation.
and insights. It's great to have a parishioner who's in this field to be able to sit down and share with us and hopefully be of assistance to our community. And so thank you again.
Absolutely.
And thanks to all of you for spending time with us. And we'll be having future events to continue our service and ministry for you.
Yep. Everybody
you.
stay healthy.
Thanks.